Hello to everyone and our audience that are watching this online video. We are about to go into another interview around our work on COVID-19 in Zambia. And so it's my privilege to introduce a friend and colleague, someone that you may recognize if you have been supporting ADRA UK for, say, the last 10 years, because Kennedy used to work with us at ADRA UK. We used to share an office together, but now he's back in Zambia and he is now leading the Zambia office. So Kennedy, would you like to introduce yourself to those that are watching the video?
Oh yes, thanks so much, Milimo. And hi everyone who is watching us. I am Kennedy Habasimbi, the country director for ADRA Zambia.
Fantastic. Thank you, Ken. So since you've been back in Zambia, it's been great because we've been able to establish a working partnership between the UK and the Zambia office. So maybe before we talk a little bit more about the COVID-19 work, why don't we just talk a little bit about the work that we are doing together?
Well, thank you so much, Milimo. ADRA UK and ADRA Zambia partnered into a project we are calling FARMS. And FARMS is a project which is actually focusing on giving skills and the market linkages to the farmers who were once refugees from DRC and the Great Lakes region. And these farmers are also mixed with the host community. And so we are putting up a big garden, which is a demonstration garden, where each farmer has a plot in there, and each one of them is given skills, and then they demonstrate on the plot. And when they will produce the food or the crops, they are then linked up to the market, which pays better. And also they take those skills to apply them on their field. This is a project which has gained actually much popularity. The UN, the government is so happy about it, and everyone is looking forward to see the results because it's a model which is just novel, and we are trying to implement it in Zambia.
Fantastic, thank you. We'll talk a little bit more about how COVID-19 is impacting the project a bit later on, especially because we're working with vulnerable groups. But let's start off by talking a little bit more about COVID-19 impact on the country of Zambia. Can you give us some information on that?
Thank you so much. Just like every other country, we are also affected, and initially the numbers were low, but in the month of April, we've been having numbers rising. We are recording almost 4 cases per day, and we are now at 72. And this is worrying because these are cases which are happening among the frontline medical staff and also in the high density areas. And as some of you may be aware, in the third world, the health systems are not that strong. And so if we are having such cases rising up and then we are having fewer recoveries, it's a concern. So the government has closed colleges and schools, and was also stopped gatherings of more than 20 people actually. And if you have to have such a gathering, then it means you have to put in place all measures like social distancing, sanitizing, masking. And so this is a challenge for especially us who do field work, because it means the trainings and all gatherings can't be done. And the challenge, of course, is also that the cost and the availability of some of these testing kits, even the prevention hygienic materials are not readily available, or if they're available, they're out of reach for most people. So this is causing a challenge to the country as a whole. And we are a net importer, and so our borders are partially closed, but we have no option but probably to open up. Besides, our people also, some of them live on $1.90 per day. And so they can't afford, they have no savings, so they can't afford but to live. So they can't stay home. They just have to find a way of survival. So this is a challenge at a country level.
Sure. I mean, apart from the challenges, the more vulnerability that's around your health service, it sounds like very similar challenges to what we're having here in the UK, people needing and wanting to work, but not being able to because they've lost their jobs. same challenges of social distancing, etc. So it seems that the strategy is pretty much the same across the world. Would you agree?
I agree with you that actually we are using the WHO strategies, which the Minister of Health is implementing, and it's challenging actually. I mean, in implementing because of the kind of livelihoods people have. And so we say watch and see, but of course, certain towns, for instance, Lusaka is the epicenter. Other cities or other towns are not yet that much, but sometimes probably it's because the testing is not so much. So, but most of our projects, we have projects here in the city, but most of our projects are in the outskirts, including the farms project, which we'll talk about.
Sure, yeah. And just to clarify for those that are watching, Lusaka is the capital of Zambia, hence why it is the epicenter. Okay, so let's talk a bit more about the projects, our farms project that we have together. We can probably start off with our target group. So we're working with host communities, those that are already living and working in that area, in that region, who are themselves considered to be Zambians. But we've also got the influx of refugees that has come over from the Congo. Is that correct, Ken?
Yes, thank you. Actually, Zambia and Ethiopia are two countries which are experimenting what they are calling the Comprehensive Refugee Response Framework. This is a framework where the former refugees, instead of keeping them in camps or isolating them, they have to be matched with Zambians. And this is because we realize that sometimes the refugees get much development and much help than the local communities, and that leads to conflicts, social conflicts, and people disliking them. So by having them within the community, and government also plans with them, and whoever is helping the entire community, that helps in integration. And actually there are many skills which also Zambia is benefiting from having such a community. So these are former refugees from DRC, Burundi, and the Great Lakes in short.
Sure, yeah. Okay, thank you for clarifying for our viewers. So let's talk a little bit more about their vulnerabilities, their living conditions, and a bit more about the project as to why, if COVID-19 was to reach these groups, what would make them particularly vulnerable?
Thank you. They are particularly vulnerable in the sense that, first of all, from the camps, they are just given some portions of land where they have to basically start living there. And some of them are frail, and some of them don't have even the proper skills. And the other challenge is that they will face is the water situation, because in this case, when you're talking about social distancing or frequently washing your hands, sanitizing, water and soap are something which is quite maybe easily affordable in such rural areas compared to the sanitizers. But if they don't have the water and the soap is not there, and they have to walk maybe long distances to gather water for them to use, then it means the washing frequently will not happen. And this then puts them at a disadvantage. And apart from that, they are also hand-to-mouth kind of livelihoods. It means they have to go and interact with people. So social distancing will not work for them per se, because they have to go and look for a livelihood on a daily basis. And then this exposes them to risk.
Sure. Yeah, it is. It's a challenge. And what about staff? How are your staff operating? Because obviously they need a required and continued support with their activities. We don't want to halt activities, but we also want to make sure that our beneficiaries and staff are remaining safe.
Thank you. As ADRA Zambia, we have a health and safety policy and plan in place. And so our immediate priority is to make sure that our staff are safe and secure, and then even our beneficiaries are also safe. And so we've provided the protection, PPE, to our staff, in this case masks. We've provided for them also some hand sanitizers, and we've also given them disinfectants. And we've also asked them to always make an assessment of the situation And so, for example, instead of going to a training of 20, 30 people, we've reduced it to 10 people, and then there will be social distancing when they meet, even for such minimum of 2 meters. And so those are some of the measures we are trying to put across so that our staff, and luckily our staff are only 2, and so in the field, so that makes social distancing quite easy to manage.
Yeah.
But for the head office, where we have more staff, we've asked the staff to work from home, those who can, and only a few have to report if they need to. But even in such a case, they have to take care of those measures which are keeping them safe.
Sure. And there's also, I guess, the risk of being, because the project location is so close to the border, there's also the risk of not just a potential spread of the disease from Lusaka up, but it could come across from, others that are living on the border or in other countries and then crossing over.
That's a very valid point, Milimo. And where this refugee camp is actually closer to the DRC border. And no wonder most of these refugees were coming from DRC into Zambia. And the DRC has quite a high number of the cases comparatively to Zambia. And there's quite serious some cross-border trading which goes on. And so they are quite actually at risk because contamination is quite easy because of the trade going on there. And even some of these arrivals who come, the refugees, because they come almost on a daily basis. And so there is that high chance actually to catch the disease because of such risk exposure.
Sure. And these refugees that are part of our farms project, are they living in camps or they're living in settlements? What is their living conditions like?
Well, the refugees who are part of our program, these are refugees who have been given some permits or some status, meaning they are no longer in the quarantine, then they are living in the settlements. So each one of them is given a 5-hectare piece of land where they can settle. The challenge, of course, is that the trading between those who are settled and those who are in the camps, there's no boundary per se, so they can easily go back and come back, and so that exposes them. And because there are better amenities in the camps, you'll find that most of the times, probably they go back in the camp, even if they have some settlement out in their plot. So that interface is quite high.
Sure. And so I'm sharing a bit more details about this particular project because for those of you who are regular donors and supporters of ADRA UK, this particular project with Zambia has been funded by our annual appeal, our annual fundraising efforts. So I'm taking the advantage to get a bit more information from Ken about, some of the challenges and a bit more information about, this particular project, as you may be interested to follow and know exactly where your funds have gone. So thank you, Ken, for sharing on that. I think maybe we can wrap up and talk a little bit about the mitigation strategies. So we know that the farms project between us, ADRA UK and ADRA Zambia, is not ADRA Zambia's only project. We know that you've got other projects. So talking a little bit more strategically, in regards to ADRA Zambia's approach and implementation, what other measures are you putting in place to mitigate and reduce the risk of COVID-19 impacting your projects and also, impacting your staff?
Thank you. So first and foremost, there have been some restriction in movements ordered by government so that we don't take the project, the disease or the risk to many other parts of the country. So it's difficult actually to travel to project sites now. However, our way of working, first of all, strategically, is that we partner with the government and local structures on the ground. And starting from the planning stage, all the way even in implementation to the closing of the project, we involve government partners, we involve the local authorities, we involve all the community members, so that even when we are far away like here, all we need to do is to call. And now, thanks to WhatsApp and other media, we can still even ask for photos or even try to see what is happening on the ground by someone just giving us a live video. of what is happening on the ground. So that has helped us to monitor the project even from a distance. Secondly, we've also asked our staff in the field basically to be more proactive now and engage as much as possible. And most of the projects, we are lucky is that we don't have a lot of staff. The maximum we have per project is 5. And so they are able to actually continue even in the need for social distancing. And apart from that, we have also partnered with the Ministry of Health, where as we do our project activities, we are also taking awareness on COVID-19, which is actually making it easier for us to access some of these places because we are doing that. And in doing this, we make sure that the PPE for our staff is the acceptable one and our staff are safe. And we do the daily checkup of what is on the ground so that we don't endanger our staff. And when we feel that it's not safe for them to go in the field, they stay at home and we still get the information either through phones, the like. Sure. And we've also actually been coming up with TV spots as well as adverts. We are using the social media quite a lot, as well as the Hope channel in Zambia to disseminate some of the information and some of the activities which will keep our beneficiaries safe and even the general populace who are watching, especially Hope channel.
Fantastic. This is great to hear. I know Zambia is one of our smaller offices in the network, but it seems that, still very impactful and that you have a really good and strong strategy in place. So pleased to hear that, Ken. Maybe final thoughts, we can just end off and talk a little bit about donor funding. Has ADRA Zambia been able to access any donor funding to support the COVID crisis? Or do you anticipate being able to? I know it hasn't been easy. Many countries are still battling with the crisis themselves or waiting for it to kind of hit them. But it's interesting to know whether you've been able to get any additional or plans to get any additional funding to support.
Thank you. As you said, really, it's difficult because this pandemic is actually worldwide. And so everyone is trying to sort out their problems maybe before they look away. But we have not just been sitting around. We have been going to coordination meetings through the UNHCR, who are trying to access some funding so that partners who participate in those meetings can have something. And in all the projects we are doing, we've been in touch with the donors to tell them that, look, we are not able to do certain things because of the situation. And so I'm glad to say that all the donors have been positive about it. They've asked us to look at the budget and see how we can support some of the awareness and maybe distribution of hygienic material. I'm also thankful for the church in Zambia because they did support us. Like 2 weeks ago, we did do a distribution in one of the locations where we are doing projects in Lusaka, and we supported 200 families actually with hygienic material, and this received quite a lot of visibility, and we did actually even send some of the photos to ADRA International. They are displayed there, you can check, and so this was impactful, and this has also raised the interest of the church members who are willing actually to support the church locally, to support ADRA, say how can we help so that we help ADRA to raise funds to distribute some of these items. And so it's also quite interesting to note that we found some local funding here, and we've also written some proposals targeting ADRA International Network, basically for some of the funds which can help us to work on the COVID-19 awareness. I am glad also to mention that one of the projects on HIV/AIDS, the youths, which we are doing in Lusaka, funded by the Swedish Mission Council and ADRA Sweden, they have allowed us to alter some of the activities so that we can use the available funds into the project.
Fantastic. I really love to hear about your community initiatives. The fact that you're trying to partner with the church. We're doing the same thing here in the UK. but most especially that you're utilizing technology and social media. I think that's really important. So really glad to hear about your plans there. What can I say, Ken? Thank you so much for your time, for sharing some information with us, around the work that's happening in Zambia. I really hope that COVID-19 is controlled in Zambia, and that you won't have a peak or rise of cases. But I wish you and your team all the best. As you know, we are working together in partnership, and of course we're here to support you through this crisis. But if more importantly, I guess I wish you and the team to stay safe whilst you are riding this out. Thank you for your time.